ways we can grow in this. As the patient, if prayer works, if we can visit them and cause healing and hope, if we can help families through tough times, if we can take patients off of life support in a timely manner to help the hospital save money, if we can do that, then we've helped the patient and the family and the whole team. The staff are busy. Some of them are Christians, some of them are believers, some of them are people of faith. They go, I wish I could stay 3 more minutes and talk. I don't have time. I got to give these meds. I got to do this breathing treatment. I've got to take blood here. I have got a schedule. I wish I could. But if they know you're here, they can call you. They can get connected with that. I mean, I do have, and I'm not saying employees can't, because I have people that clean the room who pray with patients. Nurses do, respiratory. Here's a good trick. When I've been in a room and it's time to pray, and here's a respiratory therapist standing there waiting to do their job, if I'm reading that this is a spiritual person, I go, it's time to pray now. I grab their hand, the physical therapist, respiratory therapist, the phlebotomist, whoever there, and we pray. And then they go, wow, you included me. What do we ministers do so often? Okay, I'll wait till they leave so we can pray. Okay, they're gone now, we can pray. Why? What? Or like they're going to catch something, or we, and remember, Joint Commission said we're a team. Include them. Now, if you don't think they're a praying person, don't want to pray, I don't do that. But work with the team in that. That include the team. They will like, oh, wow, you invited me to, especially when there's like removal of life support times. The nurse has been there for days and days and days watching it. Go, come on, we're going to pray now. We at our ambulatory care, those nurses who get patients ready to go to surgery, and those who do same-day surgery, those nurses for 25 years have offered prayer to every patient that goes to surgery. That was long before I got there, folks. And you go, well, I thought there was a separation of church and state. Well, we're not the church and we're not the state. We're a local hospital, community hospital, and those nurses going, would you all like to pray before you go to surgery? No, thank you. That's okay. But those that say yes go, wow! Do you think maybe their blood pressure was a little better when they got over there to the holding area for surgery? Do you think maybe it's a little, I think I'm going to make it through this thing here? Do you think it maybe did some good? I do. So I told them, keep it up, keep it up, keep it up. So employees, non-volunteer chaplains, may do spiritual care. They do it all the time. They usually do it in secret. So I deputize them all. You're all volunteer chaplain, okay? Go out there and do your work. Don't proselytize. Don't push your faith. Don't try to get them to come to your church. Don't pass them pamphlets. Just be there for them and minister to their need. And last but not least, how does it help the hospital? If prayer works, it saves them money. If counseling, there's few outliers of those patients that go beyond the D.R.G days. If they get prayed for, or they're taken off life support in a timely manner, that's saving money and decreasing litigation if there needs someone to vent to. Let's see what I'm looking for in a volunteer chaplain. Do we take all volunteers? You wouldn't want me to, would you? Have you ever worked in a volunteer system when you go, I don't think I'm going to work anymore, if they're going to still let Joe be here? So you don't want me to accept every volunteer, right? Then you go, oh, well, they're going to accept me. Yeah, I've been reading the room. Okay, you're cool. Okay, I can size up people in just a few seconds. You're cool. But let me just talk about some of those things. Spiritual. You're able to, what if a person goes, I don't know how to pray? Well, why do you want to be a volunteer chaplain? I don't think I can pray with people. Well, you have to be able to pray. I wish you would have some calling of God. In fact, all 16 of my volunteer chaplains, I have never put out the word, does anybody want to be a volunteer chaplain in my community? Every one of them came one by one going, I can't sleep at night. I don't know who you are. You don't know who I am. I'm just wondering maybe if I could do this. And I go, come talk. Every one of them, never advertised. They just kind of going, you think it'd be okay? And I think God brought them, I did just little prayer. Prayer works, right? I just did this little prayer. And they just came along, and here I have excellent volunteer chaplains that are doing ministry. Now, not every one of them was ready first day. And some of them I wasn't too sure. In fact, I was going, buddy, I don't think this is going to work. We have to have a talk. You're just too strong-minded. I have one, my volunteer chaplain, that's a PhD in biochemistry. He is the one that invented the glue that they glue the pig valve in the heart.
Wow.
He's a multimillionaire. I mean, this is in 43 countries. Well, Nick knows a whole lot about medical. And I'm going, Nick, I know you know this stuff. That's not your job to explain. He loves to go into surgery and watch them use their glue, you know. They use it on knees and everything else now. He's brilliant, but he's not supposed to be that then, okay? I've had ex-nurses that became volunteer chaplains, and they go, oh, I'd love to look under that bandage, or I'd love to give you advice. No, that's not your job then, okay? Parish nurses have that problem with that too, coming in the hospital, coming into homes, and won't do too much. Person of character. Are you trustworthy? Are you honest? If you weren't, you probably wouldn't tell me. Nurturer. Nurturer, do you have gifts of service and mercy? I'm not really looking for gifts of preaching, teaching, and evangelism. I'm not saying evangelism doesn't happen. I'm not saying teaching doesn't happen. But I'm not looking for those that go, that's why I'm here, to preach, teach, evangelize. No. But I am looking for people with gifts of service and of mercy, encouragement, exhortation, those kind of things. Ecumenical, respect. I'm not asking you to be wishy-washy in your faith. I hope you know what you believe, and I hope you believe it strongly. But can you not push it on somebody? Can we not force it on somebody? Can we just go, respect that? I'm not saying water down your theology or change your opinion. No. Every hospital chaplain, staff chaplain has to be ordained by a certain denomination. Jewish, Catholic, a bunch of Protestant. And if we quit believing that, they'll take away our ordination. We still believe it. I just don't have to push it anymore. I believe as a hospital chaplain, I leave my denominational hat at the door when I come to work. It's not about me. I still believe all that stuff, but I don't have to push that. I used to pick that denominational hat up as I left each day. What I realize now, I don't need to wear a denominational hat. It's okay with just, I have my faith and I don't have to push that. Now that's the biggest hurdle every ordained minister will have in transitioning to a volunteer chaplain or to become a staff chaplain. It's just the hardest thing. Because we've been in those four walls, in those trappings, in that thought, and it's just hard to get ourselves out of that mold into a different field of an arena where people might disagree.
Can I ask you a question?
Yes, sir.
What if the patient start to inquire about certain doctrines?
Yeah.
And ask you about, begin to ask you questions that you would obviously explain from your denominational view, whatever.
If they say, what's your first name?
Mitchell.
Mitchell. If they said, Mitchell, what do you believe about this? Then they've asked me, okay? But if they go, I've been wondering about this, would you like to explore that? So again, I'm not saying people don't get a chance to look at different perspectives. Your motive, your goal is not to change their mind. So then they go, Larry, what do you think about this? If you want to know what, you've asked what I think about this. That's what I think. Without going, and then I think you.
Yeah.
It's like sick 'em to a dog sometimes to say, what do you think? And you, just waiting for that, okay? So if your motive isn't to come in there and convert them and change them, but they're open. Back to reading, can you read people when they really want to? It's all back to that, folks. If you can read well, really well, then I say, real quietly, you can evangelize. Okay? Don't quote me on that, but if you can't read well, you better be honest with yourself. I don't pick up on a lot of things, and maybe I'm not seeing everything here. Maybe I'm pushing too much, okay? But if you can read well,